Peptides are becoming more popular as non-surgical treatments for a variety of orthopedic injuries and conditions. This week, I answer the question of a viewer who wants to know if taking peptides would help for his low back pain from a herniated disc. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions that you've left me in the comments to the videos on my channel. And as always, this video is meant for information and educational purposes only. It is in no way medical advice, especially when we're talking about peptides, which are considered experimental by the FDA. They're not approved in this country, or most of them are not, especially the ones for orthopedic conditions. So I'm not pushing them. I'm just trying to put all the information that I can out there because so many of the comments to the videos on my channel are about peptides now that I do feel it's worthwhile to talk about. All right, here's the question. I have a herniated disc in my lower back. I want to avoid surgery. I don't want a cortisone shot either. Would peptides help me? Again, you just heard my disclaimer. This is not medical advice, and I am not pushing peptides for anybody. They're considered experimental. Having said that, could a peptide like BPC 157 potentially be helpful? There isn't a lot of data, or really any data that I'm aware of on them for low back pain, let alone herniated discs. If you ask me, would they potentially be helpful? I think that potentially they would help with the pain of the low back pain. Whether or not they would actually help the herniated disc heal, I'm a lot more skeptical about that. The disc is essentially, the analogy I like to tell people is a jelly donut, and you get sort of an opening in the outer part of the donut and the jelly leaks out. Even if it could help the outer lining of the disc, the annulus fibrosus, that inner disc material may already be out. I'm not that convinced that it would do much for that nerve root impingement from the inner material, the nucleus pulposus, that has already come out, maybe pressing on a nerve root. So potentially could help with the pain. What I do like about peptides, again, sourced from, prescribed by a physician, especially knowledgeable in peptides, from a legitimate compounding pharmacy, is that generally they are thought to be very safe and little in the way of downsides. So I definitely think it could be an option, especially if you're trying to avoid cortisone shots. I think you also think about other treatments for low back pain and herniated disc. Physical therapy, I think, can be very helpful. Walking and getting sort of on a walking program has been shown to be very helpful. Typically is good. I agree, not a big steroid fan. Try to avoid this oral steroids like the Medrol dose pack, but those can certainly be options as well. Also, where a little plays a role, if it's just back pain, the treatments are a little different than if it's back pain, but you also have pain shooting down one leg, or numbness or tingling or weakness in the leg. That sort of gets you a little bit more toward the more aggressive treatments, whether that's, again, an epidural steroid injection or even potentially surgery to remove that part of the disc material, a microdiscectomy that's causing that nerve root impingement and the problem shooting down your leg. But long story short, would peptides potentially help the low back pain from a herniated disc? Potentially, but again, we don't have a lot of data on that to say, hey, this definitely would work. All right, if you want a copy of my ebook, The Arthritis Solution, albeit the solutions that I talk about in there would potentially help a lot of different injuries, not just arthritis, you can get that completely free. Click the link in the description below this video. If you have an orthopedic injury or condition and you want to hear about options other than surgery or other than cortisone shots, you can click the link in the description under this video, fill out the contact form to learn more about scheduling an appointment to see me. I'd also love to hear your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't offer you medical advice, but I might answer your question in a future video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.